Stigma against people with substance use disorder is a set of negative attitudes and stereotypes that can create barriers to treatment and make these conditions worse. Although substance use disorders are chronic, they are treatable medical conditions. Studies show that people who have SUD face stigma and discrimination in part because others do not understand these disorders or how they can be effectively treated. Many people are not aware that substance use disorder is the result of changes in the brain that make drug use compulsive, difficult, or impossible to stop without adequate support. The behaviors that people with SUD display during active use may alienate them and reinforce certain negative stereotypes around substance use. It is important to point out that compulsive behaviors and brain changes due to substance use are not permanent. People can and do recover, especially with the help of treatment, peer coaching, and other interventions. How does stigma affect people with substance use disorder? People who need care may not seek it, out of fear of being judged or punished for their use of substances. People with SUD receive poorer quality care due to medical professionals letting their biases affect the way that they treat and care for these individuals. Most importantly, stigma perpetuates the cycle of people suffering from SUD, often increasing their use due to the way that they feel about the stigma and about themselves. They feel guilty for using and blame themselves for their illness. The best way to address stigma is to make a conscious effort as a community to use stigma-reducing language regarding SUD. By making a conscious effort to be more sensitive, we are changing the way that we think, which influences the way we act and treat people. By using non-stigmatizing language, we can encourage people with SUD to seek treatment and to be more comfortable in medical settings because they are free from scrutiny.